Hi, I'm Dana Simiu. I'm going to handle hand washing. So we are going to understand why are we supposed to wash hands, when are we supposed to wash hands, and how are we supposed to wash our hands. So starting with the first question, why are we supposed to wash our hands? We are preventing any communicable disease that may be carried by germs or viruses in our hands. When are we supposed to wash our hands? After touching any surface. That can be a table, a chair. If you're going to the market, you've picked some vegetables, some fruits, so you're supposed to wash hands immediately after touching them. Second, we are supposed to wash our hands before performing any procedure to a patient and after performing a septic procedure to a patient. Before handling and after handling any patients surrounding, we are supposed to wash our hands. Then how are we supposed to wash our hands? So before we start washing our hands, the first thing we have to ensure is that our nails are short. The nails should be short. Then ensure that the wrist does not have any object, and these we are looking at our watches, we are looking at the jewelry that we put along in our wrist, so ensure that we've removed them, because viruses can also be found at the wrist. We are going to consider the specific areas that most of us tend to ignore while washing our hands, and those are the areas that the viruses or the germs can be. And for the viruses and germs, they are so tiny that they can't be seen with our bare hands. So at those areas, they tend to be at those particular areas. And which are these areas? We are looking at the palm, the region of the thumb, we are looking at the dorsum, we are looking in between the fingers, we are looking at the nails. So that's why I'm saying that our nails should be short, because some of them tend to hide within the nails. So those are the considerations that we must put in place before washing our hands. And while washing our hands, first we have to ensure that we have running water and soap or alcohol-based sanitizer that we will use. For my case, I'm going to use water and soap to wash our hands. So I have soap with us. I have a tap that has running water that we are going to use. So first thing first, you have to wet your hands, then apply soap. So you wet your hands. Apply your soap. Rub. At least it should form the foam. And then turn to the dorsal part. We interlock the fingers at the dorsum part as you rub at least 5 times. 2, 3, 4, 5. That's on the left. Repeat the same on the right. 1, 2, 3, 4, 5. Come interlace the nails, the fingers with the palms together at least 5 times. 1, 2, 3, 4, 5. Interlock the fingers. 1, 2, 3, 4, 5 times. 1, 2, 3, 4, 5. Rotational of the fingers at the palm at least 5 times. 1, 2, 3, 4, 5. So you've started with the left, we shall do the same to the right. 1, 2, 3, 4, 5. Rotation at the thumb, because we say that also at the thumb is the major area that the germs can be, or the viruses. So we start with the left. 1, 2, 5. Right. 1, 2, 3, 4, 5. So we go to the wrist, and the reason why we said we should remove our wrist watches and any jewelry is because we have to wash the wrist part. 1, 2, 3, 4, 5. We started with the left to the right. 1, 2, 3, 4, 5. So we want to rinse our hands. We've done with the steps, so we have to rinse our hands. So we'll have to open our tap. We'll use the elbow to open our tap. So when rinsing, do not do not combine the hands to wash separately. Then close the tap. After you've washed, ensure that you place your hands above the waist at a 90 degrees. Pick your towel. If you have a tissue, you can use it. If you have serviette near you, can use to wipe your hand tapping. But if you are in an area that you do not have towel, there is no tissue, there is no serviette, position your hands at the right angle above the waist, in front of the chest till they are dry. So after you've rinsed our hands, do not shake your hands. Let them remain upright so that the water can drop downwards. Thank you, and practice it while at home, while at school, or at the hospitals. Practice hand washing, practice good sanitation. Thank you.
I'm Baya Enoch. I'll be taking you through hand sanitizing. So in this process, we're going to answer 4 questions. 1, why should we sanitize? 2, when should we sanitize? 3, what should we use when sanitizing? And 4, how to sanitize. Now 1, the why. The aim of sanitizing is cleaning the surfaces that you're sanitizing, and in this case we're talking of hand sanitizing. So we want to clean our hands so that we can make them microbe free. We know that most microbes live on different surfaces, including our hands, and on the day-to-day activities that we do, we come to contact with different surfaces, and during the contact with these surfaces, we carry with us different microbes. So for us to make sure that our hands are free of microbes, we have to sanitize. Now, when do we need to sanitize? Sanitize anytime that you feel like you've come into contact with a surface that you're not sure if it was safe or not. If in the clinical setup, you have to sanitize before and after taking care of handling a patient. If you handle the surroundings, maybe beddings and things that a patient have used, you also need to sanitize your hands. Outside the hospital setup, you sanitize after touching any surface. There are no specific times that you can say this is only the time that I'm supposed to sanitize, but anytime that you touch any surface or anytime that you think like you've contaminated your hands, then these are the good times, or these are the times that you're supposed to sanitize. What are we supposed to use to sanitize? If you're sanitizing, all you need is a hand sanitizer, most commonly known as hand rubs. Be careful, there are so many sanitizers out there. The sanitizer you need should be alcohol based. If it's not alcohol based, then it's not going to help you because it won't kill any microbes in your hands. Now, the procedure of sanitizing is very simple. Get your sanitizer, spray your hand, get at least a palm full of the sanitizer, rub your palms together. After rubbing your palms together, rub the dorsum part of your hand or the back of your hand. Rub the other hand also. Then rub in between your fingers. Do the same for the other hand. Between your fingers on the palmar side. Do the same for the other hand. Don't forget to rub your thumbs. Then with fingers interlocked, rub the tips or the back of your fingers against the palms. Do the same for the other hand. Then in a circular motion, rub the tips of your hands against the palms. The same for the other hand. And after about 20 seconds, your hands will be clean, and the sanitizer that you sprayed in your arm will also have dried up. It's that simple. After you're done, you're sure that your hands are safe and you're good to go. Thank you.
Greetings, my name is Faith Njagi. I'm a lecturer in North Coast Medical Training College, and this time I'm going to take you through one of the very necessary skills you need to study, you need to actually do regarding to COVID-19. Now, I want to teach us how to use what we call a medical infrared thermometer, aka a thermogun. Now, before we get there, I want us to be able to understand why do we need to take temperature. Now, you realize that COVID-19, or rather coronavirus, causes a respiratory infection, and one of the major symptoms that could tell you that this person is having COVID-19 or is suffering from COVID-19 would be fever. So it is very, very necessary for us to check for temperatures for everybody who comes in, or again, some of the times or moments when we need to take temperatures is when we are doing triage and at entry points. And every time you take these temperatures, you need to make sure that you record them. You put them down on paper so that it is easy to be able to know how many people came in and what having high temperatures. So if we have any case, it will be easy for us to contact trace from the very people who had high temperatures. Another thing that is very important for us to note is that for somebody to have coronavirus, it is not a must for them to have high temperatures also. So that is something that you also have to have in our minds. Okay, so I am going to take you through the parts of the thermogun that you're going to use so that you're conversant with it, so that when you're handling it, you're able to know what is where and what to do. So now, here is our thermogun. So now, we can see this place, we are calling it the display screen. Now you can see it has it turns green when you turn it on. So now this part is a display screen. Then we have this part, which is the sensor, the infrared sensor. Then we have this part, which is the on and off measurements button. And then you have this part, this is where we put the battery. So the battery here. So you can see the two batteries there. Okay. Now that you already know the parts, the next thing you're going to do is I'm going to show you how to make these measurements. Right, so number one thing is that as much as we are doing this, you need to make sure that your safety comes first. And one of the things I'm going to start by doing is by putting on my mask very well. Alright, now that I have my mask. So remember we said that you are taking the temperatures on somebody when you're triaging, or for somebody on an entry point. So you're going to have somebody coming in, and I'm going to do the procedure on them, and I am hoping you're going to be able to see this really clearly, and you can always ask questions. And I'm also going to do this as I am explaining what I am doing. So this is what I'm going to use, our infrared thermogun, and we are going to direct the sensor towards the skin, and then you're going to use the on an off measuring button to do it. So there we go. We'll give it a minute, and there we have your measurement is at 6.7. Thank you very much for your time. Now we can see very well from the display we have that 6.7. Now that is normal. Now remember, the normal temperature is between that 6.5 to that is 7.2. Now if it is above that 7.5, you remember you need to very well to note it down, so that when we have any case, the very first people we're going to contact are the people with high temperatures. Thank you very much.
Hi everyone, my name is Faithful Juhudi. I'm mentor in North Coast Medical Training College. I'm here to take you through respiratory hygiene. We all understand that coughing or sneezing, this is a reflex that normally happens to you automatically, so you cannot control it. I'm going to take you through a technique that can enable you cough and sneeze without transferring the microbes from yourself to the next person or the surfaces around it. So first, in situation where you're having a disposable tissue, okay, like for me here I have one and I have the urge of coughing or sneezing, I can fold the tissue, then apply it on my palms, then cough or sneeze, and then I'm going to dispose it. So demonstration, okay, that's it. Then fold your tissue, it's disposable, so you're going to dispose it into the bin. And in situation where you don't have a disposable tissue, you can use your elbow, like you fold your elbow like this, then cough or sneeze at your elbow, or open your shirt or blouse like this, then you cough and sneeze. Fold your elbow, then you sneeze. That's it. Or you open your shirt, then you sneeze. That's it. So these ways are going to prevent you from transferring the pathogens that's from you or to the surfaces around where someone else can come into contact and contract the microbes. Thank you.
Hello everyone, my name is John Mwana. I will be taking you through on a session on how to wear a mask. And it's very much important to understand this basic procedure because it will help us in this era of corona. What is the main purpose of wearing a mask? The main purpose of wearing a mask is to prevent you getting communicable diseases or preventing others from getting it. In simpler times, we're saying you can wear a mask. The purpose of wearing a mask is preventing yourself and preventing others. Therefore, the microorganism does not get into you. How do you prevent others when you have a mask? You're preventing these communicable diseases or spreading of these communicable diseases to others. When you wear a mask, you are not able to transmit. Let's say if you are sick, you will not be able to transmit this microorganism to others. Okay, so it's important to understand the purpose of mask. So it's not only on COVID-19 alone, but largely in prevention of communicable diseases, especially the respiratory communicable diseases. Apart from COVID-19, the normal rhinitis or flu. When you have flu, you can use a mask at that moment because what is also viral, you can prevent them from spreading to others. Okay, highly infectious respiratory infections and the active phase of TB, you can also prevent others from getting that because it's also droplet infection. Therefore, which are these masks? There are several types of masks that are being used, but to mention a few, we have surgical mask, we have cloth mask, we have the N95 mask, we have masks with respirators. Okay, so there are so many of them, and all of them, they have a function of preventing this spread of communicable diseases, apart from also the COVID-19. But with this era in COVID-19, they play a very major role. So now basically I'll take you through how simply to wear a surgical mask. Before I proceed, on how to wear a mask, you should note that it has all these parts. Okay, note the colored part, the more darker blue and the lighter blue. Okay, so always before you wear a mask, what should you do? Wash your hands with water and soap. If you don't have, sanitize. So I'm sanitizing. Okay. Why are you sanitizing? You don't want to contaminate the mask, because now here we are assuming this mask is in the mask box. So you don't want to use just your hands to come and pick the mask, because if you do so, you will contaminate the mask. Now, once I've washed my hands or sanitized the way I've done, then I'll come and pick one mask and hold it at the edges. Okay, and identify which is the upper side and which is the lower side. The upper side to fit your nose. There's a hard band here on top. There's like a band, which is tough. This is now the top one. Then look at which side, the blue one, or the lighter blue, or the blue one. Okay, so this darker side, dark blue one, is the one which is supposed to be on the outer side. Okay, so you bring it to supposed to be the outer side, and this, the lighter blue, is supposed to be the inner side on your face. Now come and do it, and press on top of this band here so that it fits your nose nicely, and pull your strings onto your ears. Okay, and make sure it covers your chin very well. Why this side? Why do you wear it like this? When you put like this, you prevent yourself from getting the microorganisms from the environment to do it, to enter into your respiratory system. So if it could be like, now if I'm sick, and I want to protect others, I could simply turn it opposite. Okay, the darker side becomes the internal, and the lighter blue side becomes external. Because of what, I don't want to spread the disease to others. Now, when you want to remove, okay, when you're removing your mask, what you should do, you should hold on the strings, okay, both sides, and in a uniform manner, without shaking it, remove it as a whole and dispose it in a dustbin. Okay, so that you don't do it. Don't shake it, because once you shake it, all the microorganisms, they're going to splash on your face. So take it out, holding by all strings, and dispose it on a dustbin. Okay, then after that, wash your hands, or you sanitize again. You sanitize so that your hands does not have any microorganisms. Thank you very much.